Welcome to the Retirement Roadmap by SHP Financial, a podcast empowering today's retirees and pre-retirees to make well-informed financial decisions that will help you spend more time living and dreaming than worrying and wondering. Are you ready to get started? Let's go.
Welcome, everyone, to another edition of the SHP Retirement Roadmap podcast. I'm Derek Gregoire, and joined by a guest who's been on multiple times, who's done so much for our community of clients. A lot of you know him. It's Scott Hokanson, president of Braybo Benefits and founder. I left that out. How you doing, Scott?
Fantastic. Thanks for having me today.
Good Christmas. Good month of December just flying by.
Yeah, I'm awfully lucky. We have a great group of kids, and I actually take great pride in the fact they're all good gift givers.
Really?
Which I like. They put effort in for each other, for me, and good stuff. Yeah,
my boys have to learn.
Yeah. It's good. Like they put effort in. It's fun.
That's awesome. Yeah, we head up usually every year, like up to Maine, get some rest and relaxation, recharge the batteries. But before we do all this stuff, we have to still end the year with some amazing healthcare talk. And but it's one of the things. It's amazing. So we've been doing this going on our 22nd year, and I know you've been doing it longer.
30, and so October 31st, on Halloween, I celebrated my 30th year having an insurance license.
So a few weeks ago, just so you know, well, the listeners know, I've said this before, but when we first started our company in September of 2003, Scott is the one who gave us an office. I forget we won't go through the arrangement, but it was very cheap.
Yeah, it was good.
And it was at I thought it was the old Hokanson building. That's what I always called it.
It was at the time, so obviously we're not there anymore. So Hokanson Insurance, we sold to Eastern Bank in 2007, and then I started.
Do you guys own that building?
We didn't. No, we didn't. We leased it. Yeah,
okay.
Yeah.
So it was on Schuster Street in Pembroke. So we, a few weeks ago, my son was finishing up his, he made the football all-star team, and he had practiced. We live in Lakeville, but we had practiced Bridgewater and Hanover and Marshfield. Anyways, we're up in that neck of the woods, and we stopped by the old building.
You did? Yeah. It's a therapy place now. Children's therapy, like ABA therapy place.
And my boys knew right away, isn't this where I'm sure I've showed him at some point in my life, isn't this where you started your company? So Scott gave us the first, he helped us out start the company in 2003. You even had, helped us with some contacts, and then the rest, here we are 20-something years later, still working together, and which is pretty cool.
It's awesome. Very amazed with what you guys have done. And
same with you.
Yeah, it's awesome. Good stuff.
And the thing we always you look at our everyone knows we have 5 different worlds, if you call them. You know, the thing we always say, the main difference between what we feel like we do and not every other firm, but most firms, is they focus on just the financial investment piece. Like, I have money, I made money, I lost money. Oh, the market did well. My advisor did so good. He made me 25%. Well, you should. The market was probably up 25%. And a good portfolio is important. But if you're neglecting other areas of a plan, right? We dedicate millions at our company to employees and software and just training and research for our investment committee, right? We have CFAs. We commit a ton to that.
Yeah.
But that's only one piece of the puzzle.
Yeah. What I see when clients get referred from your office to mine, their gratitude towards how you guys look at their whole life, is evident. It's really neat.
Thank you. Yeah, I think that's the thing and more importantly, we said we always look at if we're a retiree or going to be retired, looking at retirement down the road or already retired, we want to make sure we have a full plan, not just a piece of a plan. I want every I dotted, every T crossed. So for us, that's creating an income plan, an investment plan, a tax strategy and plan, which we'll get into a little bit today, an estate and legacy plan, and then finally a healthcare plan. So healthcare is one of the questions I feel like folks, when clients come in, they're the most confused about that because it is confusing. And there's a few different areas that we'll talk about today. Yeah. One is pre-retirement. Mm-hmm. So what are things changing in that realm as we head into 2025 around private insurance? And you have some cool scenarios that you're going to share for business owners that are listening and employees of how that goes and how that strategy gets decided on by employees of what health insurance they choose and why. You also have the window of when folks leave a job but they're not 65, and how do they go about finding coverage? That's another fascinating thing. So many clients of ours, they worry so much about getting to 65 because of health insurance.
Right.
Now, but I'm like, well, if we just plan to pay a little bit extra for a few years,
you're fine.
Yeah. So that's another area. And then the final piece we'll get into is when you are retired, you have Medicare, right? So maybe we'll start with that, if that's all right.
Sure. Obviously, when you turn 65, you get access to Medicare. Medicare A starts right away, has no premium. It's not free. You've paid for it. Your employer has paid for it. You and your employer both pay 2.5% of your pay every week. Or every time you get paid.
When they say it's free, it's not.
It's not free. Okay. Yeah. But if you did not work more than 10 years and you came to my office and you needed Part A, I'd be billing you about $550 a month for that Part A coverage. That covers the hospital stuff. That's why people always think Medicare is so much better. It's because we start $550 a month. We got a head start.
Yeah.
It's something that's worth $550 a month you're getting for $0 at that time because you've already paid for it.
Is it people that don't qualify for Medicare?
Sure. It might have a recent American, a new immigrant that came in, only been here 3 or 4 years. So I've got grandparents chasing grandkids. Grandkids are over here, and they came over. I had one come over. This is a funny story. I had one came over from Sweden, and he, the parents, they had grandkids here, so they moved from Sweden to here. And he knew me as the health insurance guy. Well, at the end of the conversation, he was asking me to get more powerful pain meds. And I said, that's not what I do here, sir. He thought I was a drug dealer. But that was literally, and wherever he went to in Sweden, I guess that person knew where to get powerful pain meds. He goes, our pain meds weren't powerful enough. That was a funny conversation. Yeah, he wanted, the advice he was looking for me for. But Part A you get, and if you're still working, for a lot of people, staying on their employer plan makes sense. For some people, it doesn't. Some people, they can get off of their employer plan and join Medicare, pay the Part B premium. For most Americans, it's $185 a month per person for Part B. For a lot of your clients, it's not the case.
Yeah.
Where they have to pay more for that. And I have an appointment later today with the business owner. I've been trying to get him to convince him to go to Part B. Yeah. But he owns a place, and he'd be paying the highest premium amount.
Exactly.
And it just kills him. He just refuses to pay it. And that's a big part of where SHP and Brabo come together.
Yeah.
Is that Part B planning.
Exactly. Yeah. So think about if you're listening, right, when you're retired, as Scott mentioned, you have Part A, technically free because you paid in. You're not paying any more, we should say. Part B is basically what you have to have. B's doctors, right?
Yeah, so A is the hospital bill.
Yep.
It pays 80% of the hospital bill. B pays essentially 80% of doctors' lab x-rays. And then we're left out there not having C.
Yes.
C and D, which are making up those 20%, and the prescriptions is Part D.
Yeah, so you basically need to supplement the Part A and B that's not covered by Medicare. You need the supplement, and then you need Part B to help supplement the cost of doctors. So in hospitals. So when that being said, when we're working on financial plans, it's amazing because you think of the worlds I mentioned earlier. We talk about, Scott, income and healthcare and taxes all have a role.
And if you're once again, together. And disclaimer here: Scott's not securities license or whatever. But what I've learned from SHP over the years, sometimes transitioning your qualified plans into a Roth IRA makes long-term strategy. Well, that event might trigger an increase in Part B premium.
Exactly.
So what SHP does a really good job of is quantifying that. And then we can decide. You just said the Part B premiums range from $185 to $272, all the way up to $714 a month
per person.
Per person. Everything with Medicare is always per person. So maybe there's a stepped strategy of the transition to Roth.
Yep.
That makes sense. Well, okay, we're going to bump up, and that's going to make you hit that 269 number, not the 714 number.
Yeah.
That becomes a conversation.
So if you're basically, let's say if you're working right now, let's say you're in your 60s and you're working, right? We're always looking we always try to unwind, if you will, the pre-tax dollars that are in almost all of your accounts. So almost every client, I'm trying to think of one that, it's been a while since we haven't seen one, but almost every client that comes to us has pre-tax dollars, which means they put money into a 401k IRA. They get the tax deductions over their lifetime, but every time and some people say, why did I get suckered into doing this? Well, we all did. But every time you put $1 in, right, you get the tax savings, but for the rest of your life and even onto your beneficiaries, all the future growth and those dollars you put in are fully taxed at the current tax rate when you take it out. So, right, it's so basically, the question is always, do you want to tax the seed or the harvest, right? So in as a lot of our clients, we talk about diversification of a portfolio, we also want to talk about tax diversification. And so in a perfect world, our clients have a mixture of pre-tax, post-tax in Roth dollars. Roth is tax-free. So what Scott was mentioning is we do a lot of strategies around Roth conversions, right? You take an IRA, 401k type, you pay the taxes smartly within certain brackets, and then move it to the Roth bucket, which it's never taxed again. There's no minimum distributions. So it's a great strategy if done correctly, but you have to do it you have to make sure you do it smartly, because as Scott mentioned, if you make under, I think next year for 2025, it's 212,000, I believe. Mm-hmm. If your modified adjusted gross income, right? So you don't get that standard deduction. If it's below 212, then you each pay, if you're 65, you pay $185 a month each for Medicare Part B. If you go from 212 to like 260 something, I believe it is.
262, yep.
Yep. Then your premium goes
272 a month.
So think about that. That one jump, 185.
Yeah, $1,000 a year.
Now it goes to 272, all the way to $700 something dollars.
Yeah.
So that's why it's important when we're doing planning. Like I was just speaking with a client this past week, and we decided to we wanted to do a conversion because we're slowly taking some pre-tax money, moving it to Roth, and over time these little 60,000, 100,000. Now all of a sudden they have $400,000 or $500,000, $1 million in Roth, which is a huge deal. But you do it over time. So we decided with this client, they're on Medicare, both husband and wife. We said let's jump into one extra tier, right, of Medicare. And they said, why would you voluntarily pay more? And the answer was because if they don't do anything, by the time they're 73 and they're required to take minimum distributions, their total income is going to be like $300-something thousand, which will put them into like a really high,
really big one
bracket. Now they're Medicare. If you're
making $350, you're at $537 a month
per person, right?
Per person.
So think about that. So that's why if we do nothing now, we get some savings for a few years, and then from 73 on, if you live to be 95, all those extra years of paying $500 each per month, it adds up. So that's why I'll pause for a second there, but that's why it's just important when you're doing this type of planning. It's not just income planning. It's not just tax planning. It's not just healthcare. In order to make a decision around tax planning, you have to look at income and healthcare,
right,
to make those decisions.
And the other problem is that we look at a year plus behind. So for January 1st of 25, we're looking at 2023's tax return.
Good point.
So even if you fixed it now, you know what I mean, you're still looking at a year ago's time. So it takes long-term planning. It does. Everybody knows this, right?
Yeah.
And what I like about, if you're going to stay on your employer's plan, there is no penalty on the employer's plan based upon your income.
Yeah.
The price is the price. So sometimes these Roth conversions are better done sooner.
Yep.
Because your employer price is the same whenever.
Yeah, you're not paying the extra Medicare.
Right. Exactly. I would say 20% of the SHP referrals that come over to me stay where they're at. Because it's the right thing for them to do at that time. You know what I mean? Because listen, guys, don't jump over here, because right now we'd be hit with this, and that's always. I cannot stress enough. I just finished open enrollment on Saturday. I was in the office till 8:00 on Saturday, and I don't work many Saturdays of my life. Okay, and I met with 135 people during open enrollment this year. 135, and this year, about 90% did make changes.
Yes.
Because of the prescription things that happen. But most years, that number would have been like 50 or 60 people.
Yep.
And 50% would have made changes and what have you. This year was particularly complicated because of a positive change to prescriptions. I think overall it's a positive. Prices went up a little bit, but I think it's essentially what happened. The cost of prescriptions got capped at $2,000 over the course of the year. Yep. Where in the past there was something called a donut hole. People could have been hit for $8,000, and it was wrong.
Yeah.
And we can only afford so much, and now they made some changes. So the premiums went up a bit, but nobody's going to get hit with $8,000 next year. Which
that's what we all do here at SHP. Yeah. We all say that's the beauty of. Again, a lot of clients know I've said when they have questions around anything health insurance, whether it's pre-65, post-65. I say, listen, Scott, if you end up working with him, he makes money because that's what he represents those companies. But I've known him long enough where I know that's not his motive. It's trying to help.
I know you. And they tell their friends, and then I make money.
Exactly. You do the right thing, you're going to be okay.
I literally had a couple in my office apologizing because they didn't buy from me this weekend. I'm like, guys, you made the right decision to stay over here.
Exactly.
And they were funny. They were like, I'm like, it's okay.
That's why
I said, tell your friends. And
that's why it's easy for us because we know there's not going to be, let's try to fit something that doesn't make sense. He's going to look at your situation. Okay, what based on your situation now, pre-65, post-65, retired, not retired, what's the best plan? And sometimes it changes. That's why it's important to keep up with, like you said, the 135 people going to see if we should make changes, and 90% of them did.
Yeah.
So go ahead. So on Medicare, what is the prescription drug plan determine?
So the biggest change that happened was, in the past, I had a plan that was 50 cents a month.
Yeah.
Okay, for people that didn't
affordable.
use much. Okay, the cheapest plan we had this year was $12.40. So if you do a percent increase, it's insane.
Yeah.
6,000%, whatever it was. But it went from 50 cents to $12.
Yeah.
Okay, so for people that don't use the prescriptions that much, okay, your premium went from 50 cents to $12. Okay, that's a negative, but the essential thing that happened was that whoever takes expensive meds, Enbrel, Humira, but you don't have to be very ill to be stuck on some expensive meds. And those people are now much better protected. And what we did find, though, is that the race to spending $2,000 just got faster, because the insurance company said, okay, this drug used to only cost $20 a month. Now that drug's going to cost you $40.
Oh, okay.
Do you see what I mean? So now that drug just went from $50 a year to $480.
Yeah.
So I think we're going to have a lot more people end up in that $1,000 to $2,000 range of out-of-pocket costs, where in the past it wasn't. And that doesn't show up on my spreadsheet.
I see.
The only thing that shows up on my spreadsheet is the actual cost of the premium. So that's why you can go on Medicare.gov and put your meds in, and it spits out both what the premium is and what your costs will be. And that's where I spent my last 6 weeks, of helping people say, okay, last year you were with Mutual of Omaha, this year you should be with Cigna, last year you were with WellSense, now you should be with Aetna, I don't know.
I see what you're saying.
And what also happened is some plans don't cover certain medications. So if you're on something like Trulicity, that had a limited number of insurance companies offering it. So you had to make sure you were with one, or there might be, an insurance company that has 8 plans and only 3 of them covered Trulicity.
Oh, so you have to make sure you're with that plan.
Right. So what's fascinating to me is a reasonable person can say, does Aetna cover Trulicity? The answer is yes.
Yeah.
But it doesn't cover it on every plan.
Oh, my gosh.
How can anybody figure that out? It's tough.
Yeah.
And they won't find out until January when they go to get their refill.
So,
and they missed because they had to make their decision by this past Saturday.
So how about the other question I get, vision and dental?
So I don't love selling vision and dental. So first of all, there's 2 different chassis you can buy health insurance through in Medicare. One's called a supplement, which $200-something a month basically just makes up for the difference of what Medicare, the gaps, called Medigap policies. Those plans don't have dental and vision included in them. The other chassis to buy from is called an Advantage plan. Lower in premium, they include medical, dental, vision, and prescriptions all under one package, which is nice. That's what 3 out of 4 people buy in my office. But they have co-pays. They have an insurance company saying, the example we talked about earlier before we went on air was knee surgery. Under the supplement, the first column, the Medigap policies, you just get the knee surgery.
Yeah.
In the second column, United Healthcare might say, we want you to do 6 weeks of physical therapy first.
Yeah.
So that's kind of the difference that, once again, doesn't show up on the spreadsheet. You have to earn that knee surgery. Right. So the dental and vision, when it's included, is great. I try to convince people not to buy the Advantage because of the dental and vision. It's a nice add-on.
Yeah.
But don't choose one or the other because of the dental and vision.
Do you ever ask people what the normal out-of-pocket is for dental and vision? Like,
if you're going for cleanings and stuff like that, right? Because if I were to sell you a private dental plan, it's called $50 a month. Make it easy on me. It's like $48. But so you're going to spend $600. The maximum benefit's anywhere from $1,000 to $1,500.
Yeah.
You're giving me $600 to maybe get $1,000.
Yeah.
So if you know you're getting a crown, great, go ahead. But if you're not getting a crown, you usually don't end up financially winning.
Well, it's just amazing. In the last 21 years being at SHP and owning the company, I've seen so many clients that one of their biggest bills is a dental bill. I have this big dental bill coming up.
Yeah. And even if you bought dental from me,
it's not I
would have taken $1,000 off, maybe $1,500.
Yeah.
Okay. So those big crowns, the big reconstruction that happens, $6,000, $7,000, $8,000. I would have taken off $1,500 plus some discounts, so maybe that $8,000 bill would have gone down to $5,000.
It's not free.
So then, okay, paying the $50 a month is worth it. But to me, I usually don't recommend it that much, to be honest with you.
So for an average retiree, let's say they make a combined under $212,000 in income in retirement. Mm-hmm. They're on the lowest tier for Medicare Part B. They have an average Medicare supplement plan. Would you say, what would you budget they would be out of pocket? So you're figuring
their two choices are $185 a month, so just no additional premium for an Advantage plan.
Yep.
And we have wonderful PPOs here in Massachusetts, Mass General, Blue Cross, Tufts. They're all good. So you pay $185 a month. If you want to get a supplement, which would then do two things for you, you have essentially no out-of-pocket costs when you use the plan, and there's no network, there's no referrals, there's nothing. That would be $412 a month. So your delta is about $2,400 a year.
Got it.
So is it worth $2,400 a year? Two people fall into those categories. Once again, out of my office, 1 out of 4 buy a supplement, 3 out of 4 buy an Advantage plan. And the only reason why the 3 out of 4 buy the Advantage plan is because it's cheaper.
Yeah.
Okay, that's it. That's literally the reason why.
So if the 3 out of 4 buy an Advantage plan, what's the cost there?
Yeah. So the reason why the supplement might be the right choice is because you have a lot going on.
Yeah.
I had a person come in my office. She has a mental health visit once a week. Well, on an Advantage plan, that's $50.
Got it.
So that's $2,000 right there.
Yeah.
$2,100 just for that one visit every week. So
if someone's on an Advantage plan with Part B, as a couple, what is it? Maybe like $5-6 a year.
Say $5,000.
Yeah.
Yeah. So I had a new client. She was a hot ticket, and she was from Greece, and I asked her if she ever got a chance to go back to Greece. She goes, well, this $5,000, I will. Yeah. You know what I mean? And she goes, we hadn't gone back in a year. She goes, but you just saved me $5,000, and they were both on supplements, and they should, they're going to move over to Advantage plans because they were healthy as can be.
Yep.
And they just weren't recommended it before. And the other nice part about Medicare is this decision is only ever a 1-year commitment.
Yeah, that's good.
Okay, so people go, well, what if? And if I can make one request to you for the rest of your life, never send me an engineer, because they have the what ifs are tough, man. They're tough. I had 2 engineers.
They're tough with us too.
I tell you, they're tough. And I had this one, what if? I'm like, okay, the crystal ball is broken.
Sometimes I always joke around with, I'm like, it's almost the analysis by paralysis by analysis. You're not gonna make the right decision because you have too many things in your head of variables.
I had this one guy who was a really smart guy, and it was awesome, and we had fun together. And I was just saying, listen, I don't know. I don't know if you're going to get diagnosed with cancer in June.
Yeah.
And then if you did, you should have bought a supplement last January.
Yeah.
And it killed him to not be able to plan for that.
Yeah, you can't.
Do you know what I mean? But he was going to save $5,000, and his wife and him were healthy as can be.
Yeah.
And he goes, well, everything I've read says, yes, a supplement, and I'm not allowed to use this word, but I'm going to hear on the podcast, is better. Okay? It's better. Okay? The experience is better. It's the government spending government money. They don't care. They just say yes. Under an Advantage plan, they can save $200 a month, and they include medical, dental, and prescriptions. It's because they say no enough to make up for that.
There's some catch.
There's some catch there. And that's fine, as long as you know that going in. And I put my parents on an Advantage plan.
Yeah.
Okay?
Yep.
So for them, they're healthy-ish. Everybody's on, a Lipitor and, whatever, so, and to me, everybody has their own situation, and it is common for couples to walk out making different decisions each, which is okay.
That's the thing, even with us, like you can't, when you're building a financial plan, it's obviously not one size fits all. We can't tell you before you come in what your plan's going to look like, because it depends on income and retirement dates and goals and expenses and there's so much that goes into a financial plan. And even that's why when we send our clients to you to build out this portion, there's so much that goes into just that strategy. Mm-hmm. And what healthcare, we always, we'll have a certain budget. If someone's retiring at let's say a couple's retiring at 62, we might say, all right, we're going to budget $20,000-$30,000 a year for the next till you're retired. Yep. And maybe that's sometimes high, sometimes low. And then $5,000-$6,000 a year with inflation once you are on Medicare, A, B, and so forth. And that's, that's generally how we budget it. But then also, not to keep going down this rabbit hole further, but we talked about Medicare and A, B, prescription, supplement, all that. The other thing I think, most people know this now, but there's no for long-term care, long-term health care, nursing home, home health care.
I have no custodial care. We cover hospice.
Yeah.
End of life, but you should not expect your Medicare policy to cover any custodial care.
Yeah, it might if you're rehabbing in a nursing home and from something that you can get better from, you might get 100 days.
Yeah, but once again, I don't want you to financially plan on Medicare being very helpful.
Yeah.
In those situations, and there are times where it's approved, but like what most people think of as nursing home care is not covered.
Exactly.
So you have your father with Alzheimer's. It's a tough, those are tough situations because it's expensive.
Yeah, we see it with clients all the time.
Yeah,
and that's one of the things you mentioned. Like, so when we talk about healthcare, people think, oh, it's health insurance. Well, yes, but think of how much we just talked about in 25 minutes so far.
Yeah.
And we haven't even talked about the biggest expense, which is long-term care. So
Right.
a lot goes into, when it comes to financial planning, if you're not covering all these areas and it's not being looked at every year, it's not just set it and forget it, because look at how many changes you had last year.
Right.
In the different changes in when the IRMA kicks in, the different prescription drug plan options, the Medicare options. So there's so much to look at. If you're at this age, obviously, you want to financial planning is one thing.
Right.
Make sure you have a financial plan. And then obviously within the financial plan, make sure the healthcare strategy is taken care of. So at SHP Financial, which is our company, and Bravo Benefits, which is Scott's, we work together so much on these plans. So that's really it that we're going to cover today in terms of like an overview on Medicare. And that's awesome, Scott. Thank you. Just like the Medicare changes, what's going on, what it looks like for next year, what people are thinking of. Then also I wanted to touch briefly on, let's say folks like companies.
Yeah.
We at SHP have Michelle. We have almost close to 60 employees now, and there's decisions that are made. And I guess we were talking off air, but our employees don't really have a say. It's really
it's tough. So there's about a month ago there was a situation where the United Healthcare CEO got shot.
Unbelievable.
And I'm guessing it was for somebody who had a claim denied or something like that. And what's frustrating is that person probably had no decision-making authority in the fact that his employer chose to go to United Healthcare.
Yeah.
And I sell United Healthcare every day. It was my most popular Advantage plan for years, and this year it wasn't as much, but I recommend it to employers all the time, and it's really the employer making those decisions, and it's frustrating that the employee really has no choice in that. But it's also our delivery of healthcare as a society is done through employers.
Yeah.
And I'm not sure that's why SHP went into business, to be in the health insurance business. I can tell you, it's certainly like my plumbers and electricians, they don't want to be in the health insurance business.
Yeah.
And somehow they're stuck making this choice for their employees.
So if you look at, for companies like ours, what are the main choices that are out there? Obviously United Health.
Yeah, so we're lucky enough to be in Massachusetts, where there are really good, solid plans. And I put United Health, Cigna, Aetna, in one national carrier bucket.
Yep.
And then we have local HMOs, which are different. Blue Cross, Tufts, Harvard, Mass General are the main ones. They feel a little bit different, but they might be 20% more expensive.
Yeah.
And when 90% of the employees don't use the plan all that much, they go for a physical, they get a couple scripts, go pediatric visits a couple times a year, maybe a kid breaks an arm, they all work awesome. Sometimes 10% of the people want that softer feel, that an HMO will give them. But then they also don't want the referrals, where the United Healthcare plan as a PPO doesn't have the referrals. It's tough, man. It's tough. It's tough to blend it. And this comes into play for your clients when somebody wants to retire at 60.
Yes.
And they might be coming from a 2,000, 20,000 employer company.
Yes.
Okay. I had a couple flight attendants come to me from one of the big carriers this year, and they're coming from union negotiated perfect health plans, and I don't have that.
Yeah, of course.
Okay, so if you want to plan for that, you're looking at now about $1,200 a person for an average plan here in Massachusetts.
Yep.
That's your number. It used to be $1,000, now it's about $1,200.
Yeah, so about 30,000.
Yeah. So so for me, I as an S corp owner and as a family plan, like the first $50,000 of my income goes to health insurance.
Really?
Because it's not taxable. It's
yeah,
not tax deductible. You know what I mean? So I got to pay the premium on it. Now I chose to have 5 kids. My premium's high, so that is what it is. But so for people retiring, you have to plan on paying for health insurance. It's not uncommon for me to have a couple where one's eligible for Medicare, one's not. Mm-hmm. It's okay. There's plans available. It's just over $1,000 a month.
I will say though, for those clients listening and those folks listening that are not just out there working and doing and trying to get to this point, so many people overestimate the cost of insurance is high if you retire before 65. Yeah. It's brutal. We're talking $15,000 for one, $30,000 for two on average. But I would say, like, I have clients all the time. I say, let's say they're 61, and I tell them, every time you go into work, you're working for your kids. I know you're thinking you want to get to health, you want to get to Medicare, and then you can retire because health insurance is so expensive. But we've built your plan. Let's say you need $100,000 a year to cover your expenses. Okay, we just add an extra 20 to 30, depending on what it costs for health insurance for the first 4 years of retirement, right. And then it goes back to $100,000 for expenses. And guess what? Your plan works fine. So sometimes I'll show like projections or Monte Carlo to age 90, and it's like if you retire now, you're going to leave $3 million behind. But if you work till 65, you're going to leave 3.2 behind. Is it worth going to work every day? Yeah. That's obviously just every scenario is different. But a lot of folks, it stinks. It's heavy. It's high. But you just do it. You build it into your plan. Just like taking a vacation. You just do it. You're paying for freedom of not having to go to work in that scenario.
Yeah. Well, my kids, my financial plan doesn't include saving them money.
Yeah,
I loved them and educated them.
Before I got into this room, one of my clients, I love him to death. He's a great guy. He will do anything. He's just talking about he's gonna take some money out to buy 2 cars for his kids, and the kids are they don't even want them, but he has found a deal. And he's gonna take an old car so they can have these brand new like discount. And I'm like, I won't say his name, but I'm like, you think do something for yourself, you know what I mean? Right. He's so worried about the kids and the next generation. Awesome guy, super good family. But I don't think, I always say like, I always tell my clients, my recommendation is, don't not do something and not travel and not, if you're in a certain circumstance where your kid's like disabled, there's scenarios, but in a normal scenario, I would not recommend you not doing what you want to do in order to preserve X dollars for the kids, because they have their whole lives to do it. They have their whole lives. You worked your butt off to get to this point. I would say, most clients say, I want to spend, if something left, awesome, but I want to make sure I spend what I need to spend on our lifestyle.
Yeah, I agree. I'm on that team.
So when it comes to, anything else in the health insurance world?
No, really. It was just for next year.
Yep.
Or if you are retiring in 2025, just make sure you do the evaluation on the prescriptions you're taking. Because saying, does Aetna cover Trulicity, is not enough of a question.
Yeah.
Okay. You can ask your doctor, you can ask your pharmacist. They're going to say yes, but you might sign up for the wrong Aetna plan that doesn't.
Yeah.
And that's just, everybody here at SHP knows how to get a hold of me.
Yep.
It takes me 5 minutes to do it with you over the phone. And there's never any obligations, no ever fee to ever meet with us. If you buy from me, I get paid commissions by the insurance you buy.
Yeah.
That's it. There's never a fee to meet with us. And because you're a client of SHP, you get access to Scott Hokinson directly.
Yep.
And I'm proud of that. And you're proud of that. And,
Very proud.
And we've had this great symbiotic relationship that I think has benefited our clients mutually.
Oh, it's been huge to us and so many of our clients. And is it BraboBenefits.com?
At BraboBenefits.com, BraboInsurance.com. You can all find it, all that way. And Google Brabo Plymouth. It should come up. Hopefully only good things.
Yeah.
And I really appreciate everybody here at SHP. Hope you guys all had great holidays. And here's looking to a great 2025.
Yeah, thank you, Scott. I think in closing on my end, I think just what I always say is that for those of you that are do-it-yourselfers, when it comes to some people say, I don't want a financial advisor, I just want to do it myself. Make sure not only do you understand every aspect of the market, when to rebalance, when to tax loss harvest, what funds to pick, what stocks to pick, what risk profile, everything there, but you also have to be up with all the changes in income, changes in tax codes, changes in health insurance. There's like 50 different things you have to do. So I always joke around, if you want to be retired, sitting on a computer every day with research tabs for tax codes, Congress changes, estate planning changes, healthcare. That's great. But if it's me, I would think of it just when retirement planning is so much more than just a portfolio. It's just all these things. So that's what we do at SHP. So for those of you, a lot of you are probably listening, are clients of ours. So those of you who are not, want to learn more, it's shpfinancial.com. But again, we're a resource, and if health insurance is the need, then obviously Scott is our man, and his company at Bravo Benefits will take care of you. But there's so much to think about. We just don't want you to get to retirement and say, I'm going to do this all myself. Maybe some of you, that's what you want to do. God, more power to you. I would not want to do that. But for those of you who want a helping hand, want to be able to enjoy retirement and rely on a team to look at all these boring statistics and tax codes and Congress changes every year, that's what we do. But once again, Scott, it was awesome. Thank you. Look forward to seeing you in 2025 and beyond. And hope everyone's having a Merry Christmas and Happy New Year. Talk to you soon.
Thanks for listening to the Retirement Roadmap podcast by SHP Financial. If you've enjoyed today's episode, be sure to hit the subscribe button so future episodes are automatically downloaded directly to your device. And if you've liked what you heard, please share the show. Create your own little ripples so we can help even more people with their retirement goals. If you want access to all past interviews, including notes, resources, and exclusive content from SHP Financial, visit shpfinancial.com/podcast. Thanks again for joining us on the Retirement Roadmap podcast. And for all the attorneys out there and disclaimers and disclosures, I'm just going to put on my super serious voice and add our own. No statements made during the Retirement Roadmap podcast shall constitute tax, legal, or accounting advice. You should consult your own legal or tax professional on any such matters. Information presented is for educational purposes only and does not intend to make an offer or solicitation for the sale or purchase of any specific securities, investments, or investment strategies. Investments involve risk, and unless otherwise stated, are not guaranteed. Our investment advisory services are offered through SHP Wealth Management, LLC, an SEC-registered investment advisor. Insurance sales are offered through SHP Financial, LLC. Our advisors and insurance reps may offer clients advice and/or products from each entity. No client is under any obligation to purchase any insurance product.